Well, hi, and welcome to the second hour of The Nature of Health for Saturday, July 30th, 1994. My name is Barry Chowka, and many of you may have heard me here before on KCEO AM 1000. I've been a guest and a substitute host for Don Bodenbach, and that's what I'm doing today. Don is out of town, and he'll be back with The Nature of Health next week. I'm primarily an investigative journalist and a medical political analyst. I've worked in print, film, and television, and radio. And today I have a very busy, interesting, power-packed hour ahead, so I suggest you keep a pen and a piece of paper nearby because you'll be hearing some information that you may want to take note of for further use. Information on your health, your well-being, your freedom, and on national health care reform. Now, before I turn to my first guest, I'd like to take a minute to point out or put out some ideas or talking points and to describe briefly my take on some of the issues we'll be discussing today. And these revolve around national health care reform, which, as expected, has now become the overwhelming domestic political story of this year. Now, I'm concerned about the debate so far and about the outlook for health care reform. In my 2 decades of reporting on the medical system, on conventional and innovative therapies, on leading-edge issues and so on, I've seen the incredible promise and potential of credible forms of what we broadly call alternative medicine. I've seen medical alternatives achieve an impressive market share, even though they're generally not covered by insurance or by government reimbursement. But these seem to be options that people want today. Now, one of the questions for me is, will we be free and able to continue to get access to these and other options under a mandatory federal health care system? And the broader question is, will innovation survive national health care reform? In the past decade or so, we've seen breakthrough research and treatments in areas of wellness promotion, prevention, diet and nutrition, micronutrients, and in taking responsibility for one's own health in terms of eating a proper diet, exercising, not smoking cigarettes, and so on. Now, we might wonder, what are we going to get if we turn everything over to the federal government, which has generally been a foe of medical innovation in the past? Already the government pays for around 40% of our country's total medical bill, that total being about $1 trillion a year now. And I think it can be said that the system is not really any better off for this major federal involvement we've had to date. And it makes me wonder about the future, especially if we're all required to pay the same amount for health care, no matter what decisions we make in our lives or how much personal responsibility we take for our own health. This is just part of the context I want to explore with both of our guests today. Now, our first guest in this hour has been here before, back on May 7th, so in a sense we'll be picking up where we left off then. His name is Russell Verney, and he joins us from the headquarters of United We Stand America in Dallas, Texas. Russell Verney is a top advisor to Ross Perot and is working on the United We Stand America project called Put Patients First. I'll let Russell Verney himself describe it to you, but briefly, it's a major independent national grassroots effort to, as its name suggests, truly put patients first in the current health care debate. So without further introduction, I'd like to bring on now Russell Verney in Dallas, Texas. Good morning, Russ.
Good morning, Peter, and good morning to all the listeners in the San Diego area. It's a pleasure to join you again.
Thank you, and thank you for taking time out of your Saturday to speak with us here in San Diego. Now, Russ, you have co-authored an article in the latest national newsletter of United We Stand America. Your article is entitled Healthcare Step Number 1, Fix What's Broken First. And you discuss an interesting, if underreported, piece of legislation that's currently in the Congress, H.R. 3955, the Bipartisan Health Reform Consensus Act. So I wonder if you could bring us up to speed on the Health Reform Consensus Act, and if you think from your perspective of a lot of involvement in the healthcare reform issue, and I know many trips you've made back and forth to Washington, D.C. to monitor what's going on there, if you think that this act might give us the kind of healthcare reform that would really be good for our country, as opposed to the Clinton plan and the other major mandatory plans that are out there right now?
Peter, over the last year, our organization, our members all across the country, and especially there in California, we've had some excellent groups out there working on researching what are the problems in health care, how does it affect an individual and a family, and what changes do we need to improve our health care system. And what we find is a complete difference between what people need and what Washington wants to give them. In Washington, they're looking at writing what is the last word in health care in the year 2002 or 2004, and how does Washington get to control 1/7 of the entire economy of the United States, which is the health care industry. That's something about 4 times as large as the entire automotive industry. And as folks have looked at the issue of health care, they've reviewed what the government has been able to do over the years in delivering health care, which is the Veterans Administration, the Indian hospitals, and they say it's not acceptable. They looked at the way the government has been managing insurance in health care, which is your Medicare and Medicaid programs, and they said that's deplorable. That's not the kind of health care that we want as a country for all of the people to have choice in their health care professionals or their health care clinics. What our folks have found across the country is that the real problem is in cost and access to health care. When we look at the bills in Congress, and there are some 75 bills in Congress dealing with health care, all the focus seems to be on these what are called universal plans, which are about controlling the delivery of health care in the country and letting the government be in charge of decisions as to who will provide you health care, when and where you get your health care, and how much can be spent for your health care. It's a program that's designed on penalties and designed on rationing of health care. We looked at are there any bills in Congress that really fix the problems that the folks back in the neighborhood recognize. And when my family sits around the table talking about health care, they never talked about global budgets or mandatory regional alliances or employer mandates. They talked about being able to get good information on the cost of their health care before they buy it, the quality of their health care before they buy it, so they can make value decisions of who is the best doctor to perform the service for them and what is the best clinic to perform the service for them. And we looked through the bills, and we found this Roland Bilirakis bill, the Health Reform Consensus Act, H.R. 3955, that the authors of that bill, a Democrat and a Republican, a very bipartisan bill, and it has exactly the same number of Republican and Democratic co-sponsors on it. There are, I think, a total of 70 co-sponsors. They looked through all the proposals on health care, and they said, where do they all agree? If they all agree on certain elements, then maybe those are broken, and that's what really needs to be fixed. And where they don't agree, the bills are expressing somebody's agenda. In the case of these universal bills, it's the agenda to control health care. And the Roland Bilirakis Health Reform Consensus Act begins by opening up insurance to everybody, ending pre-existing medical conditions, which prevent many people from getting health insurance because they may have diabetes or cancer or some birth defect. And that, if you became a federal employee tomorrow, there's no prohibition of you getting insurance because of a pre-existing medical condition. They have to take everybody. So why can't we as citizens have exactly what we give to our employees? Portability, allowing you, once you're insured, to move to another insurer with, again, not having to pass that test of a pre-existing medical condition. They looked at medical malpractice reform and said what we need to do is get rid of some of the defensive medicine that's going on and keep careful medicine. And they looked at waste, fraud, and abuse in the system, and they said, boy, there's anywhere between $40 and $100 billion a year that's being spent wastefully or through abuse or fraud of the system, and we need a better policing of that. Then they said, well, why don't we try and let each local community, using the existing federal dollars, set up a program designed to serve the needs of that community to expand health care to people who do not have health care insurance. And keep in mind, the debate here is insurance, not health care, because today everybody can get health care, whether they go to a charity hospital or a county hospital. They do get health care. The question is the insurance of it. So The Rowan Bilirakis bill sets up a pilot test where each community can design a program to suit its needs, the people in its community, and use existing federal dollars. We believe it's the right first step to fix what's broken, and then let's see what needs to be done to expand health care services in the future. One of the elements United We Stand America would like to see added to the Rowan Bilirakis bill is the option for people to have a medical savings account similar to an IRA account, where instead of spending $4,000 a year for your health insurance today, spend $1,000 a year for catastrophic insurance that has a $3,000 deductible. Put the other $3,000 that you're going to pay for health insurance into a tax-free savings account, and then pay out of pocket your first $3,000 out of your savings account, your deductible, and that way it puts the patient back in as the consumer. And what's been missing in American medicine since the mid-'60s is the patient has not been the consumer. The patient wasn't concerned with price, wasn't concerned with how frequently they use the system, and weren't concerned as much with wellness programs, because the third party, the insurance or the government, would make the payment, and it didn't matter how much the payment was. It only mattered what the co-payment was. So,
Russ, we have to take our first break, so hold that thought. We'll be back in a minute to talk more about national health care reform on The Nature of Health. Stay with us. We're back on The Nature of Health. This is Barry Chowka, and on the phone with us from Dallas, Texas, is Russell Verney of United We Stand America. And Russ, we just have a few more minutes left in this segment, and I want to focus on this question about national health care reform. It's been my impression, looking at the national debate, that it's primarily driven by political agendas. We find, for example, this week in the LA Times national poll that only 22% of Americans are now saying that health care is the nation's most important problem, yet we see the Clinton administration apparently staking its political future on getting some kind of health care reform plan through the Congress before the elections. We also see in the LA Times poll this week that found that pessimism about the U.S. and about Clinton specifically are, in the words of the Times, eroding support for the president. So I'd like to ask you, as a representative of United We Stand America, an independent group, if you feel that this politicization is affecting the health care debate in terms of either the administration strategy or the efforts of the other major parties that are out there proposing national health care reform.
Absolutely. I think that there was, during the recession of the last few years, when people felt insecure in their jobs and they worried, if I lose my job, I may lose my health insurance. That could be financial disaster for my family if someone comes down with a major illness or injury. That was what fueled the original proposals on health care reform. And there are certainly reforms that need to be done and have needed to be done for a long time, like the insurance reforms. But that feeling out there of insecurity among people who had jobs allowed the administration to come in with this very sweeping plan that takes and reverses the entire health care delivery system in this country as we know it, for the benefit of the special interests within the healthcare industry, those who profit off of it, like the insurance industries and hospitals and clinics. And they didn't design the program based around patients and what the patient's needs are. I think what you're seeing now in Washington is that the administration has staked its reputation on health care, and although the economy and crime and education are equally as important or more important, their political reputation is at stake in this battle over health care. And no matter what the plan looks like, it seems to be their goal to get a plan through. I think in the House and the Senate right now, you have the majority leaders writing new plans, which aren't quite the Clinton plan. They're Clinton-light plans, just so that they can get enough votes to pass it. They don't even care what the details of the plan are, so long as they can pass some plan that looks similar to the Clinton plan. The problem there is that when you start taking elements out of the original proposal, you no longer have a whole program that can work. You have a program with holes in it. I don't believe that the original one could have worked, but what one that has big holes, gaping holes in it, certainly is never going to work and serve the patients. It may serve the political agenda of people in Washington say we passed health care reform, but it doesn't serve the needs of the patients, which is what health care is all about.
Well, it seems to me, Russ, that we really have to be aware that of what you've just pointed out there, that this is politics mainly that we're talking about in the national health care reform scene. The Clinton plan started in secrecy with the health care reform task force chaired by Hillary Clinton, which mainly considered the musings of self-described policy wonks and numbers crunchers, and now the whole thing has been turned over to the hands of the politicians there in Washington. And
well, I don't think it was as pure as that, Peter. There have been a couple of lawsuits against that task force requiring them to disclose who was on it. And as you look down the list of people who were actually on that task force, they were represented the special interests that are going to benefit from managed care health care system mandatory nationwide.
That's a very good point. I think we've seen in this last week in the coverage of the Whitewater hearings, whatever one thinks about that issue, what the Congress is capable of and the kind of infantile partisan behavior that tends to characterize what goes on Capitol Hill. And I think really the same thing is going on in the healthcare debate. Maybe it's not quite so obvious, but before we leave you, Russ, I'd like to give you the opportunity to let our listeners know how they can get in touch with you or your organization and what kind of input you're looking for from the American people for your organization, Put Patients First.
Sure. United We Stand America is located in Dallas, Texas. They can write to us at Post Office Box 6 in Dallas, Texas, or they can call us at 214-960-9100. We're a nationwide grassroots organization. We have a chapter in each of the 50 states. We have chapters in all 435 congressional districts, a very, very active organization in Southern California down there in the San Diego area. They deal with, they're just citizens that want to get involved in taking their government back and making it responsive to the people on issues of economic reform and government reform. And people would like to participate with the organization, get involved in issues. We do not support individuals or their personal political agendas. We focus strictly on economic reform and government reform issues, and that's the way we look at health care. How does it impact our quality of life and our standard of living? And anybody who'd like to get involved, please give us a call at 214-960-9100, and we'll put you in touch with the folks in the Southern California area who are very active on these issues.
Well, Russell Verney of United We Stand America, Put Patients First, I'd like to thank you for joining us here this morning, and I've been impressed with your work and your organization, the kind of questions you're asking and the way you're coming into this issue of national health care reform, and I think that our listeners should consider getting in touch with your group to see how they can interact with what you're doing. So thanks again for joining us, and I'm sure we'll be checking in with you in the future as this issue goes forward.
Peter, thank you very much, and thank you to your listeners for the time to talk to them.
Okay. Russell Verney of United We Stand America.